The next presenter is the last one, Zuhra Luqman. She's going to talk about her experiences in German international cooperation in terms of Pakistan.
Thank you, Aisa. Hello, everybody. I'm Zuhra. I'm working with GIZ as a gender advisor in Pakistan. GIZ is working in 130 countries and it's having 17,000 employees all over in these 130 countries, while 60% of those employees are national staff. And while our headquarters are in Ashbourne and Bonn, it's working on behalf of Federal Ministry for Economic Cooperation and Development, DNG, and since 2011, it was first GTZ, but since 2011, GTZ, DED, and Invent, they merged together and then they formed GIZ. In Pakistan, GIZ is working since 1961. And in present portfolio, it's working in education sector, in health, in renewable energy, and FATA. FATA is Federal Administrative Tribal Areas, which maybe you know, very dangerous areas in our country. And it's also working with Federal Bureau of Statistics, and it's also working in Northern Pakistan and Malakand, and my present project is working on governance. So shelter work is focused under our governance project. This is the map of Pakistan. You can see Pakistan is bordered with Afghanistan on one side, then India, then towards Punjab side it's toward Iran also. So it's a map of Pakistan you can have in your both sides. The governance program is actually a promotion of good governance in Pakistan. It's having 3 components, which you can see. One of them is administrative reforms. It's focusing on local government systems. The second is tax reforms, and in Pakistan, as maybe you are aware, that mostly the taxpayers are common men. The upper class level, they are not giving taxes. So this tax reform program is focusing on collecting the taxes from the upper class, just like politicians and landlords and other persons. And the gender reforms. So gender reforms, it's mainly focusing on to improve the services of governmental and non-governmental actors for the prevention of violence against women in KP, Khyber Pakhtunkhwa, and FATA. In this governance program, our implemented partners are Government of NWFP and Provincial Reconstruction, Rehabilitation and Settlement Authority, and it's also Federal Bureau of Revenue, Government of Pakistan. You can see. We are working on prevention of violence against women under governance program in 4 forms. First, we are focusing on analysis side. We are focusing on collection of data, specifically on GBV, because in Pakistan officially we don't have GBV data. So mostly we have to rely on different data which is collected by the national NGO. So that's why this time we are focusing on data collection as well. And then the national strategy, legal situation, and human resources. And second stage in planning, we are focusing on improving services in women's shelters. So that's why I'm here, and I was in Second World Conference also. And then we are also focusing on training on violence against women and counterparts in case of government. We are building their capacity, that how they will formulate the policy, how they will implement the policy in order to prevent the violence against women. Because although Pakistan is signatory of CEDAW, but we do have so many good laws for prevention of violence against women, but all the problem is in the implementation of these laws. So now GIZ is working with government departments in order to build their capacity to implement these laws. And we are also focusing on media campaigns, because in Pakistan media is also so much popular and influencing the grassroots level community through radio, through TV, through newspapers. So we are focusing on media campaigns and prevention of violence against women. And then we are also having a strong cooperation system with civil society organization. The third is monitoring. That we are also playing our role in order to build the capacity to monitor their services to prevent violence against women. And then on impact level, we are also having intervention that how these improved services, they can fulfill the requirement of the violence against women victims. As I discussed that GIZ, actually in Pakistan, very few NGOs, they are focusing on shelters. The reason, as Bandana also shared in her discussions, that the donors, although we are having a lot of donors over there, but they come always with specific agenda. When they come to Pakistan, they say that we do have this amount of money for this type of works. Shelter is not their priority. So only we have to rely on government-run shelters. And government-run shelters, they are very few in numbers. They are ineffective, I will say. They are just fulfilling the blanks. And you can say it's a small prison, sub-prison for the women. Because the domestic violence survivors, if they contact police or if they go to court, then they send it to the shelters. So there is need to build the capacity of these government-run shelters. We are also playing a role in review of existing laws, because the existing laws are also having some gaps which need to be fulfilled for prevention of violence against women. So we are also focusing on this. Media campaigns I discussed, and data collection. Yes, because yeah, this is the main presentation points. So you can go ahead. GBV definition I gave, but I know you will also be following in your own countries because this is universal definition. Women's shelters in Pakistan, we do have, actually in Pakistan we do have 4 provinces. So we have 5 shelters, government-run shelters in Khyber Pakhtunkhwa, and 1 halfway house. This is recently, you can say this is rehabilitated and renovated by GIZ. 34 shelters we are having in Punjab, 4 in Sindh and 1 in Balochistan. And we also do have 21 women drop-in centers. These are the figures, but you can, if you have visited somewhere in Pakistan, you can see that it's having nothing, just name on shelters. These shelters, as I mentioned, these are sub-prisons, you can say. They don't have any, they were not having any SOPs, standard operation procedures, and guidelines to be implemented. So first, GIZ, in collaboration with other NGOs, they take the leading role to develop some guidelines along with the government of Punjab. So when the Punjab notify it, again GIZ and other NGOs, they play their role to build the capacity of these government-run shelter staff how to implement these guidelines, because they were not having any guidelines, they were free, how they treat these survivors, how they refer to other government organizations, how they keep it, how they force them to leave the shelters, all were their own will. But now after these guidelines, they are a little bit bound. So in 2007, guidelines were formulated with the technical assistance of GIZ, while police department, health department, lawyers, NGOs, different NGOs like Our Foundation, Shirkat Ga, Dastak, and MDU also gave their valuable inputs for establishing these new standards. This was, I will say this was a new and this was an excellent achievement, because having no guidelines, having no SOPs, everybody can do anything with these survivors. Now in KP, Khyber Pakhtunkhwa, again we have the problem that we were having shelters, but there was no guidelines for these shelters. So again GIZ have to take leading role in negotiation with government, with other NGOs. So we formulated recently, very recently in July, it was notified by the government, and now we make a roadmap for implementation of these guidelines. So in these guidelines, they are covering the women's shelter management, training of shelter staff, referral services, because they don't have any referral service, and even they don't have fund for the medical treatment, for legal aid, for other things. So now GIZ is working on mapping of referral services to link those service providers with these government shelters in order to get benefit for our GBV survivors. they were not having any idea of working days and hours, but these guidelines, they are covering these things. Attitude and interaction with residents, this guidelines is covering this. Code of conduct of women's shelters, dealing with residents, rules and regulations for residents, discharge of the residents, records and documentation of residents, monitoring of women's shelters. So these guidelines, they are covering all these things now. First, there was nothing. Kind of support entitled for GBV survivors. We know information referral resources are needed, psychological counseling, legal support, safe shelters, seeking help for supporting immediate medical support, facilitation in collecting adequate documentation. So we are building the capacity and we are making the referral mechanism along with other NGOs. So hopefully in near future, in maybe next conference, I will be able to share our main achievements in these fields also. Yep. And these are the essential pre-requirement of the support extended. Under guidelines, the government staff, they are bound to follow these things now: confidentiality, maintaining dignity and respect of survivors and her choices, safety and security of the survivors and those helping her, and non-discrimination. So they are bound to follow these things. These are the steps for all the responses to GBV, which should be an these are first assess the client's needs and give relevant information. So the shelter manager, they are built, their capacity is built, how they will deal, how they will assess the client's needs and how they will develop an action of plan and safety plan that address her needs and how the client, how she will help the client to implement the plan and follow up and case closure. So these are the main things which she will have to follow. These are minimum support services structure which are required, but these things are not existing over there. This is facility, emergency support services, extended support processes. These are required. And we, along with other NGOs, we are trying our best to motivate government also, because this is their role to play. So that's why GIZ or other NGOs, we are not giving something ready to eat to government. We are supporting them, we are building their capacity, but we are not giving anything ready-made. Next. This is social rehabilitation and reintegration in case of reconciliation. Actually, maybe you notice that from the day first I'm asking about the rehabilitation, economic empowerment, because we do have this problem over there. Whenever this survivor, she left the shelter, she's going again to her community, again she's going in the same situation. So 2-3 times she's coming again and again to these government shelters because she's having nothing in hand that she will go back and she can live a respected life. So that's why there is need, and we are working on this. We do have plans for her social rehabilitation and reintegration. So family counseling and mediation is needed, mediation, counseling, skill and vocational trainings, which we don't have, but we are planning to give some opportunities to these shelters. Employment sources and opportunities. Actually, Pakistan, especially the Khyber Pakhtunkhwa, it's culturally it's very strict. So a woman can earn her income, but in the 4 walls of her house, she can't go freely to market, to jobs. I'm working because I'm living in a city, but if I will live in a village, then again I will have to cover all my body and just sitting inside a house. So we are focusing to give her such type of skills that while sitting at her home, she can earn income for her, just like kitchen garden, needling, stitching, these things. This is follow-up support for a fixed time frame, starting from frequent monitoring of situation to gradual phase out. We do it. Building and linking community support groups. We do have in form of JERGA, but again it's male dominated. So now the elder women, we are trying to include the elder women at least in those community setups and structured follow-up programs. Shelter rehabilitation, again, it should have a complete program and protocol of its own, but we don't have now. Thank you. Thank you.
Thank you, Zuhra, and thank you very much for saving time.